VSS has a wide variety of visual symptoms and non-visual symptoms as well. Some of the non-visual symptoms we hear frequently is about tinnitus, which is ringing in the ears. And I've had patients with tinnitus in a variety of different scenarios. I had a young man who was driving a car, got T-boned, and had a significant traumatic brain injury, and he had a lot of tinnitus and a lot of visual issues. And what he found out is when we treated him for that, and I know that's not talking specifically about visual snow, but when we treated him for that, guess what happened? He had less tinnitus too. So oftentimes when we tune down the sensory system as a whole, and by working through the visual system, which is really a dominant sensory system, about 80% of your brain is devoted in one way, shape, or form to vision. If we are able to tune down the system a little bit, usually it can help symptoms outside of just purely the visual symptoms. But as far as the visual symptoms go, sometimes they have tracking issues. Sometimes they have trouble converging their eyes. They certainly have a lot of that entopic phenomena, the spots and the staticky type of vision that we see. Some of them have trouble with binocular vision skills. Some of them trouble with vision and balance, vision and touch, hand-eye coordination. So these are some of the different visual skills, and that's why we test all those visual skills so we can come up with the most accurate way to go about treatment. So it really, once again, largely depends on the individual, but what we do is try to get a very comprehensive evaluation done first, take out all the variables, and figure out the best course of action. As we move forward with VSS, I'm looking forward to seeing more and more patients with it, as I'd like to study it a lot more. I think there's so many more things we can understand about VSS. There's some neurological studies that can be done, but really what I want to do is really develop some protocols that is consistent, that I can teach other eye doctors and other types of therapists and other types of physicians good treatment protocols so that they can help patients with VSS all over the world. It's not enough that we can do it right here in Dallas, Texas, but we want to be able to train others to do it everywhere. And I think that's kind of one of my big goals in working with the Visual Snow Initiative, is to make people more aware of it, because even, as I said, even a year and a half ago, I wasn't all that aware of it. I had heard the symptoms, but didn't know that such a diagnosis existed. So the first thing we have to do is let more people know that this exists. And then we can kind of take it from there and build up protocols and then go out and teach the protocols so that we can treat as many patients as we can and relieve symptoms. The other interesting thing I found out about VSS over time is that they truly believe that these symptoms are far more common than was originally thought. So where it used to be considered a rare syndrome, I don't think it is as rare as we thought it was. And I think as time goes on, we're going to learn that maybe up to 5 to 10% of all patients who have neurologic injury of some sort are probably going to exhibit signs of VSS.